we'll next turn to our colleague, Dr. Victor Del Rio, who will be joining us, and perhaps as a slight aside, we'll be talking about some of the criticalities of non-technical aspects of rabies prevention and control. Dr. Del Rio.
Hi, Charles. Can you hear me?
Yes, thank you.
Yeah, great. Well, thank you, Charles, and for the opportunity and for the invitation to present here today. And I'd like also to congratulate the organizers for the organizing committee for the event. It is good to be among so many all familiar faces, and many of them with much wider knowledge of rabies than me. So my talk is, as you were already indicating, Charles, is not about specific developments on rabies. It's more like good old planning applied to rabies prevention and control. And I'll be touching on a number of biases and artifacts that may affect our ability, general ability to plan properly. Now, in fact, now that I think of it, and after listening so many interesting presentations, particularly the last one from Conrad, most of my presentation is just a long statement of the obvious. If I can ask to pass to the next slide, move to the next slide, please. No, the previous one. I was just still talking on the first one. So second, can we move one further? That's the one. Yeah. So, but let me start with setting up the scene and question any notion we may all have about whether we are rational agents or not, and the belief that we actually follow decisions that are logical. There are a lot of evidence and a lot of literature about this. I only here referring to this particular bounded rationality notion from Simons, as you can see over there, that goes against this established neoclassical economics figure of the Homos economicus. Here I try to represent this figure by the thinker of Rodin, who always seeks the maximization of his decisions. But basically what Simon comes to say is that we are not such logical agents, and basically we normally tend to, let me just remove this image from here, we normally tend to look at the things that are closer to us. So for example, with time trains, we normally look at the most recent shocks and often ignore the long-term trends and tails. We certainly undervalue or downplay uncertainty of any type, and certainly we focus on immediate objectives, which is good if we acknowledge that and we are aware of that. So for example, we can break down into more manageable objectives, long-term goals such as the 2030 elimination goal. So in summary, what Simon comes to say is that we are nothing but beasts, full of emotions, and once in motion, it's actually difficult to stop. And if not, you can ask Will Smith. And I'm sure that he probably just let his system one run wild. And by system one, I'm basically referring to the two systems described by Kahneman, and that is that little picture on the left, on the right of the slide. That is his bestseller book by Dana Kahneman, who basically describes these two systems in the way our decisions go, system one and system two. And in fact, many of the artifacts that I'll be referring and describing in the next slides come from the Kahneman's book. Next slide, please. Now, this is about rabies. So what I'll be trying to do in the next few minutes is to, obviously, relate to these planning artifacts to what's happening in planning of disease control programs, in particular rabies. I'll be focusing on organizational challenges, and I'll be reflecting on my experience in the Americas. I used to contribute to the regional control program by the Pan American Health Organization. And we already had some mention of this in the previous slides, in the previous presentations. I would argue that the challenges, organizational challenges and the program priorities that were clear back in 1983 when the Americas set up the first control program are very much prevalent and relevant these days. And I would also argue that these learnings from the Americans may have some implications for global control efforts. Next slide, please. Now, let me tell you a story. I hope you can see fine. So the plot shows basically the number of deaths, human deaths, from rabies by dogs in orange. And I just see that this is in Spanish, so I apologize. So the red dots are the number of human cases mediated by dogs since 1983, when the regional control program started in the Americas, and the blue ones are human cases, this case of mediated by other species. I assume most of them perhaps bats. And as I said, this is in the entire American region since 1983 up to last week. I took these statistics from Silvera. Silvera is the Pan American Health Organization database. And you can notice that in red, circled in red, this 25-year long tail. Yeah, about 25 years long tail, where we actually have elimination goals, and we failed these three elimination goals. So these black lines basically represent past elimination goals set up by the region. The first one in 1990, and then another three following in 2000, 2012, and 2015. Now, 32 years ago, 1990, that was the first elimination goal. And perhaps back in 1990, you may argue that the colleagues setting up the regional and national priorities were too over-optimistic. But I don't think you would call people over-optimistic, back in 2000, given the number of cases that we had at the time, about 30 or something like that, when they actually thought about eliminating the problem, eliminating the disease from the region, in 2000. Perhaps they just get carried away because it was such a nice date and a new millennium and things like that. But the numbers were small. And as I said, two additional goals follow in 2012 and 2015. And if I may say, I was there in 2015. I cannot remember what sort of criteria we used to impose to basically come up with that 2015 elimination goal, but undoubtedly had a good ring to it, and it was a nice date. Anyway, now people outside the rabies domain may be tempted to think that this is actually not a very nice story, because we failed 4 times to reach elimination goals. But I just want to state, and let me be clear, this is actually a story of unquestionable success. Can we move to the next slide, please? Yes, so despite such massive successes, some people in the audience may claim that planners, basically, they were blinded by the outcomes. In this case, the 4 elimination goals that we set up. And perhaps they forgot about the journey. In this case, like in many other programs, the journey is the most important part, the learning part. And this, in a way, is a form of outcome bias. And this is one of the first bias I will be referring to in this presentation. Outcome bias, whereby planners may have been carried away by the recent successes. If you remember what Simon said in the first presentation, the first slide, we tend to look always at the most recent things. So I would argue that perhaps planners in the region, as I said, they were carried away by the recent successes, in this case, reducing endemicity, and thought, based on that outcome, that the rest of the journey would be as easy, without much consideration of what processes may require change in order to adapt to the new situation. And this is interesting because outcome bias generally leads to risk aversion. What normally happens, not only in this case, but also to us as individuals, is that once we have a surprise, for example, we fail to reach in something, we tend to overreact. And for some organizations, this leads to an increase in the number of SOPs or red tape or bureaucracy, which, if I may say, in my humble opinion, in the case of rabies, wouldn't be a negative outcome at all, because I don't think that we have enough evidence about the processes and about the journey. And this is about this slide, and hence this slide where I'm basically arguing for an institutionalization of documentation, M&E, on the processes. and also obviously using that documentation in money feeding operational research studies. I mean, some in the audience will correct me, but I don't think there is a lot of evidence or a lot of publications on operational research out there for rabies. I use this cartoon actually, and Deming's quote, quite frequently throughout the COVID-19 response. I've been involved in the COVID-19 response since the beginning, when I was calling for the need for more operational research to do better and not just keep doing things for the sake of it. And I would argue that you know, in a similar way that we wanted that for an outbreak in the middle of a pandemic, that is also applicable to an endemic program like rabies. Next slide, please. Now, if we agree with tracking processes, here I'm just basically suggesting to avoid the simplistic approaches to tracking such processes and intermediate steps. I mean, to avoid ambiguities in the constructions of mechanisms to track performance. None of us would accept if we ask a rabies program managers to give us, you know, an idea of the performance of the vaccination program. None of us would accept a vague statement. I'm sure that we all wanted to know exactly the coverage, whether it's 70% or whatever. And my argument is that surely we wanted to have a similar level of granularity for many of the capacities relating to rabies control. I mean, surely we perhaps shouldn't accept simpler measurements to other capacities, such as, you know, coordination mechanisms or surveillance sensitivity. And note here that I'm using the word measurement or the term measurement quite intentionally. And by measurement, I mean an observation that reduces uncertainty in a quantifiable manner. And I leave that floating because I won't have time to describe this in greater depth. Now, I just want to come back to this importance of quantification and measurements and having good scales to reduce ambiguity, hence the quote at the very top of the slide. And why I'm showing a picture here of a plane? Well, I used to run this exercise with some of my students when I was at the university, and basically asked them if they would entertain jumping off a plane and what probabilities, a number they would allocate to the standard riskiness, you know, or standard labels of risk that we use in many different frameworks, whether the risk was negligible or very negligible, so high or very high. I asked them to give me just a number against those labels. And I'm sure that, I mean, you've seen these studies before. The ranges were staggering. So for very negligible label, we got people saying that the risk was almost zero, and other colleagues saying, and other students saying that the risk went up to 0.2% or something, say 0.20%. So a huge, you know, variation. So there was a lot of ambiguity in the interpretation of these levels and these labels. And we find something similar actually when we conducted a similar study for COVID-19. We found that the ambiguity of the labels, if they are based on qualitative statements, their forecasting accuracy, the predictive accuracy is quite poor. We ran this study with the country's self-imposed classification labels for COVID-19, whether they were sporadic cases or cluster of cases on community, and we compare that with epidemiological data, number of cases and the number of deaths and hospitalizations. And as I said, the prediction accuracy of the labels against the epidemiological data was quite poor. Next slide, please. Yeah. Yes, I'm just bringing this slide briefly and argue that if we were rational agents, perhaps after the elimination failures in South America, or sorry, in the Americas, we should have engaged in proper risk management of the program, and we didn't. And I'm not going into any detail on this slide, just to say that at best, quite often in health projects and programs, all we managed to put together is a risk log and trying to identify some risks and then populate some suboptimal risk matrices, and just wondering why nobody tries to quantify the failure probabilities of the goal or intermediate steps up to it. And I'll come to these failure probabilities on my next slide. Can we move on, please? Now, here I basically referred to a couple of artifacts or biases as Kahneman described in his book. And it started with the planning fallacy, aka low-hanging fruit fallacy. Now, Kahneman in that book, which I recommend everybody to read, describes a very funny example of planning fallacy. He basically describes at some point in time, he gathered a group of colleagues and they basically went on to publishing a textbook on psychology. And they started the work, and within 1 year, they made a lot of progress. They met, and Kahneman was interested to know how much longer the book would take to finish. So he ran a formal elicitation process among his colleagues and asked them individually what estimates of that length of time to finish the book they had in mind. The average was about 2 years, and they were all very pleased with that result. Now, what Kahneman did next was actually, he went a little bit further, and he asked one of his colleagues who had got previous experience in publishing textbooks to provide, a view based on his experience about the prospects of this publication. And the colleague basically said that in his experience, the production of similar books took about 7 years. And in fact, about 40% of the teams that they tried to publish similar books, they failed. That is your probability of failure for a project or program. And that was astonishing. That actually took by surprise Kahneman and the colleagues. And you might be asking, what happened next? Well, basically, the group ignored the outside view or the reference line provided by this colleague. Let me just close that email. Because it didn't fit the recent experience that they had, the recent good progress that they made. Now, moving into rabies and the situation in the Americas, did we have such outside view, that sort of nuisance parameter, nuisance guide at the regular meetings that we used to have on every couple of years for all the rabies program managers in the American region? That voice questioning our optimism about the next elimination goal and perhaps bringing some warning or cautionary note. If we had it, and indeed we did, that there wasn't the proper meeting or the proper setting to actually raise that voice, because the goal of those meetings was consensus. And as it happened with Kahneman in those meetings, we basically did what Kahneman described in his book. Those, we basically, baseline statistics were treated as base rates normally are. We noted them and promptly set them aside. And also facing choice, we gave a rationality rather than give up the enterprise. I'm not arguing here about ignoring an elimination goal, but certainly we should have perhaps characterized better our chances of reaching those goals. I talk about this low-hanging fruit fallacy here, and as Kahneman fell for it, and for the planning fallacy, we also fell for it, I believe, in the American setting. I mean, we thought that the successes in controlling the disease during endemicity to that date, they could be extrapolated to other settings and probably, much more challenging settings and countries, and that was not the case. I mean, there is nothing wrong, of course, with targeting quick successes. We need them for multiple reasons. Keep the morale, justify the expenditure, requesting new funds. What I'm saying is that the speed and the easiness of those first milestones can hardly be extrapolated. And leaving the most difficult challenges and deliverables till the end is not a wise decision if one wants to hit the goal. And I'm here just mention actually the Fermi decomposition, which is a way of, as I was saying before, breaking down the big goal into smaller pieces and allocating different probabilities of success to the different steps and deliverables. If we can move to the next, which I believe is my final slide. Yes. Now, here in my final slide, I just want to bring in together all the previous concepts so far and relate those to the 2030 elimination goal. Now, you might be wondering why on earth I'm showing a rocket here. And I'm just finding a typo. It should be the launching platform, not the landing platform. But anyway, I just like rockets. And the picture, in fact, is the launching of the Apollo 11. And I'm sure you remember, if you're old enough, some of the audience might be in that range. I'm not looking at anyone. The Apollo program actually was launched by Kennedy in 1961. He made the announcement And 8 years later, 1969, we got the true fellas landing on the moon. 8 years is about roughly the same number of years we got until 2030. Another statistic, 8 years is about 1/3 or 1/4 of what is taken to the American region to reach elimination. And I'm just wondering what might be a decent reference class for the 2030 global elimination goal. I would argue that a program of this magnitude needs a reference class of the same magnitude, and discuss or say or suggest that the experiences in Americas might actually be a good reference class for the global program. With that in mind, global planners might want to look at the Americas as the reference class and adjust for the ever-present optimistic bias and the likely outruns in money and costs. And let me just finalize with this and see if I say it correctly. In other words, if we take the Katie Hampson estimate of 59,000 people dying on a yearly basis, which is already 8 or 9 years old, and here I'm referring perhaps to the need of updating our evidence. If we took that as up-to-date reference of the burden of the disease, and we also know that for Americas, it took 30 years to get here, starting from a baseline of 300 cases, which is about 250 times smaller number than the 59,000 figure that Katie produces. What I would argue is that the global zero by 2030 will demand a major technological and organizational improvements, and it will require a rocket, an Apollo mission, over 1,000 times faster than the one that we used and we just launched back in Redipra, the first meeting of the Redipra in Americas in 1983, 30 years ago. I leave you with that thought, and I think that is my final slide. Thank you.
Excellent. Thank you, Victor, for that very comprehensive philosophical need. And I couldn't agree with you more in that I don't think it's a pessimistic view. I think it's a very realistic one. And it's one of our challenges as social beasts, in that everyone wants to be successful. Everyone wants to be supported. And yet sometimes when we reach for that truth, we may not be invited back to dinner. And this is one of the realities of today, of the emperor's new clothes, if you will. So I certainly want to thank you for this breadth of reality, and also perhaps task you with a question. If we could get into that Wayback Machine and go back to, say, the first Redipra in 83, is there anything that you think with a wand that you would do differently, or given what we understand about rationality or its lack, what would we try to do to correct, to improve this trajectory that we're still on despite the progress in the Americas? Your thoughts?
At the time, I thought, and that's still my belief, that I was referring to that in my presentation. I call it the Fermi decomposition. I think, and we tried this in the Americas, for many years we tracked cases. And that is always reactive. By the time we track cases, the problem happened. At some point, actually that started years back. We used to, prior to Redipra, the Redipra, for the audience, are these regular meetings that the regional program holds in America. Prior to the Redipras, used to be a survey of the country's capacities. We wanted to know how many vaccines they had, the stock for not only dog, PEP, and we also wanted to know a bit more about, the quality of surveillance, something like that. But for many years, we just gathered that data and did nothing with it. It took us years to actually pull all that data out and start looking at what was the picture at the time. I don't think we continue that assessment, on a regular basis, or as systematically as should be. So my argument would be, given the capacity, and I know this is a huge exercise, because colleagues in the audience would say, but we don't have the data. Well, if we don't have the data, come up with something. When companies go into a new market, we ask the guys about what are the chances of selling this product or getting this market share. and the marketing guys will come up with a number based on something else, the reference class, in other markets. The reference class could be in Americas or somewhere else. But we need to start allocating probabilities of success or failure to the different components, that is something that we failed to see the RUDIPRA. We thought that the successes in some big countries with a lot of resources might be applicable in other countries, like I want to say the names. And that wasn't the case, because they were extremely challenging. And we kept waiting to address those massive challenges and leaving them to the end because we needed those successes. And I made a reference to that in my presentation. We need to take those challenges, those challenging places and settings first and foremost, from earlier stages of the planning process. Otherwise, we just basically shooting ourselves in the foot.
Thank you. And I hope you'll be able to stay with us to follow up on this discussion at the end of our speakers.